Madam Chair, members, thank you for letting me visit with you. I'm a family doc in Athens, Texas. I've been there since 1979. And
I'm so sorry, Doctor, to interrupt you, but for the record, I need you to say your name and who you are representing today.
yes, I'm Doug Curran. I'm representing the Texas Medical Association, Texas Academy of Family Docs, Pediatrics, and Obstetrics and Gynecology. And I'm just here to visit with you a little bit about what's going on in Texas and about healthcare and how we think we can change some things that'll make it a lot better for our folks. You know, I got a call not too long ago from the Kaiser Foundation to do an interview about what's going on in Texas. And you know, everybody knows Texas is booming. We got an economy around $1.8 trillion. That's the size of a small country. I think it's actually about the size of France. I think there's some sort of Texas and France doesn't seem to match up too good. But anyway, it is what it is. Texas is booming. There are a lot of good things happening. But their comment to me was, but you know, your healthcare outcomes just aren't very good. And what are you all going to do about that? And my comment to them basically was that, well, you know, in Texas we fix things. We're not happy with those healthcare outcomes either. As physicians, I don't like it whenever we're seeing maternal issues that are just unacceptable. We're having women die that shouldn't die. Most of the events that are occurring in our rates are higher than most other states. We've got to do something about that. When 20% of our people between 19 and 64 have no health care coverage, that's a real problem. Most of those people have a job. Most of them have two jobs, and they still can't make it work. When my son's health insurance costs more than his house payment, we got a problem. We got to do something about some of those things. And so maternal health and our kids, when you look around and 20% of the kids who are uninsured in this country live in Texas, that's a problem. So we've got to begin to work on that. And I see some of that happening already, with Representative Cortez's bill to improve prolonged coverage, that full 12 months. You've heard us talk about that. That's so important. And then Representative Davis's bill to improve access to women's health care and to make sure that we're covering those ladies for a full 12 months after they deliver so that they can plan their next pregnancy, so they can get some long-term coverage for those things. And the other thing that we've just got to deal with is revitalizing Medicaid payment. We haven't had a change in Medicaid payment in 20 years that was sustainable. We've had a year or two that was related to the Affordable Care Act, but for 20 years it's just what it's been. If we'd have been increasing that about 2% a year over that time frame, we would currently be at Medicare rates. So Medicare services or Medicare payment for Medicaid rates. And to even get close to that, to begin going down that road, we're proposing that we begin with $500 million, and that would be from general revenue, and that money would be used through the Medicaid CHIP Physician Payment Advisory Council at HHSC. And if you use it through that group, this group worked before when they dealt with the FRU money, and they used that to help rural hospitals to improve new models of care, to look at those things that will improve quality and make us better. And I think if we could begin going down that road to moving us toward Medicare parity for payment, we'll see improved access. We'll see a lot of things change in Texas that will make us better. I want to tell you a quick story and I'm done. Really neat thing happening at the Curran house these days. We got this little guy who's 10 months old who's crawling around, and all of us are carrying these little devices because he's about ready to talk. He's hollering and saying all kinds of things. And his dad's carrying around his cell phone, and he's hoping that, hey, he's going to say dad, and I'm going to get it on my cell, when he says dad. And his mom's running around, and we're all watching him, and she's hoping it's mom is the first thing that comes out. And then, Lolly, my wife's doing the same thing, and Dr. Poppy is in the business too. I am watching as close as I can if I could catch him with those first words that come out of his mouth. Been around the Capitol now for about over 30 days since we all started. and I don't hear much about health care. I'm really worried because this is a huge problem. It's a problem we got to work on. It's a problem we got to fix. It's a problem we got to engage. We want to help you do that. And we're here. We'll listen, we'll help, we'll be supportive, we'll be positive. We want to move forward. Thank you for the opportunity. I'd like to answer any questions you have. Any?
Great. Members, do you have any questions for Doctor? Thank you. That said it all.
That was easy.
So
Thanks.
thank you, Doctor.